Hello, I am Elizabeth, a domestic violence counselor and advocate from Connections for Abused Women and Children, or CAWC. This is CAN TV's Hotline 21, and for the next 20 or so minutes, I will be talking about domestic violence and the work that I do with Connections for Abused Women and Children. This is a live interactive show, and you can call in to ask questions or participate in the discussion. The number is 312-738-1060 and should be displayed on the bottom of your screen. I am a counselor with CAWC in their Hospital Crisis Intervention Project, or HCIP. HCIP is a program located at John Stroger Hospital and Northwestern Memorial Hospital. I worked at Stroger for about a year and then just recently moved to Northwestern, where I've been for the past few months. The goals of HCIP are, number one, to provide quality on-site crisis intervention to domestic violence victims at the moment that they're seeking medical care, either because of domestic violence or for some other health-related issue. Number two, to train healthcare providers to identify, assess, and effectively refer victims of abuse. So, to ask questions and know how to screen for domestic violence. If they screen positive, then they refer them to us. And number three, to improve the healthcare system's response to domestic violence victims through training and outreach. And so a big part of my job is talking to hospital workers, so doctors, nurses, social workers, and educating them about domestic violence so they can provide a more holistic health response to that. The way it kind of looks on a day-to-day basis is we get referrals from, doctors, nurses, social workers, any medical professional if a patient screens positive for domestic violence and is interested in talking to an advocate more. Sometimes patients, may have been in a domestic violence situation and aren't ready to talk to someone yet, but we can go and give them their information and hopefully have them follow up with us at some future time. CAWC as an organization has many other services, including counseling, shelter, legal advocacy, children's services, and support groups. These services are offered in both English and Spanish. To learn more information about our services, I'm going to put on the screen some more information from us. And so here you can see our 24-hour domestic violence hotline number. The number is 773-278-4566. You can call that number at any time and speak with an advocate if you or someone you know is experiencing domestic violence and you're interested in getting more information and resources. Our website is also on there, cawc.org, and you can go there to find more information about our services. If you're interested in volunteering, there's information on there as well. Today I'm going to talk about domestic violence. October is actually Domestic Violence Awareness Month, so this is a great time to share more information and just educate people about sort of what domestic violence looks like in day-to-day relationships. I want to start by defining domestic violence. Domestic violence, or DV, I'll use both terms interchangeably here, is a pattern of coercive behavior in a relationship that is used by one person to gain or maintain power and control over another person. Domestic violence can be physical, sexual, emotional, economic, or psychological actions or threats of actions that influence another person. So I think that threat of action is a really important note to make. A person doesn't have to hit you. If they threaten to hit you, that is also domestic violence. This includes behaviors that intimidate, manipulate, humiliate, isolate, frighten, terrorize, coerce, threaten, blame, or injure someone. And this is a definition I actually pulled from the Department of Justice website. This is a pretty official definition of domestic violence. I think a really important thing to note here right away is that a lot of people believe that abuse is only physical. However, abuse can take many forms in the relationship. And often I've seen with my clients that the emotional and psychological forms of abuse can cause some of the most long-lasting harm for clients. So I work with clients who may not be in the relationship anymore, they're not being physically hurt anymore, they may, their bruises have healed, bones have healed, but those psychological and emotional abuse stays in their head. Those feelings of worthlessness, or that nobody else will love them, or, the gaslighting that abusers can use to make their victims feel like they're going crazy. those things can stay with victims for a really long time. And that's why seeking counseling services is so important. And right now, I'm actually going to put up a tool that I use with my clients just to give a little bit more information about the different types of abuse. So I'm going to switch to that right now. So here you can see this is called the power and control wheel. And this wheel illustrates the many forms that abuse can take in relationships. And I think it's important to note with this wheel that relationship violence is often a combination of a number of different tactics. And all of those tactics work together to maintain power and control by the abuser. So that's why we see power and control in the middle of the wheel. The center is surrounded by different sets of behaviors that an abusive partner uses in order to maintain this power and control. So if you can see things like coercion and threats or intimidation, emotional abuse, isolation, minimizing, denying, and blaming, using the children as a way to manipulate and exert power over the other partner, economic abuse. And then the last one here is male privilege. And I do want to note that this wheel does really focus on heterosexual relationships and for the abuser being a man. But of course, anyone can be an abuser. We just see it more often, the man abusing the woman. A lot of these behaviors can feel subtle and normal and are often unrecognizable until you actually look at the wheel. Many of these can be happening at any one time. So, abusers using emotional abuse along with intimidation and coercion and economic abuse. The inside of the wheel is comprised of those subtle continual behaviors, and then you see on the outside, that outside sort of spoke of the wheel is physical and sexual violence. So these are often maybe not happening every day, but more intense forms of coercion, and that reinforces the regular use of the other methods of abuse. I do want to highlight just a few more specifically, because I think these are ones that people don't often think of as much when you think of abuse in a relationship. So we see here economic abuse. Economic abuse and control is a huge issue I see with my clients' relationships. Economic abuse often leads to clients becoming economically dependent on their abusers. So, him telling her she can't get a job, him paying all the bills, and also maybe giving her allowance and keeping control of the finances, that kind of thing. And this can make it really difficult for a survivor to leave the relationship. I also see this manipulation in a lot of my clients who are concerned about making the abuser angry if they're going to leave the relationship or filing for an order of protection. They have concerns about the abuser coming to their job and putting their financial security at risk. So, they're worried that he could get them fired and then they would not have money anymore. We also see this in ways like the abuser paying for their cell phone or other bills, and then they have access to the, their partner's personal and financial information. The other one I really want to highlight is isolation. And this is a really complicated one, and it's really exerts a huge impact on my clients' lives. They often feel like they're alone and they have no one else to talk to about the situation. And part of that is, deliberate isolation by the abuser. So it can start out kind of small where he says, hang out with me, don't see your friends tonight, like let's just hang out, until it becomes a thing where it escalates to taking her keys so she can't physically leave, that kind of thing. Also, with isolation, clients can self-isolate where they feel a lot of shame about being in an abusive relationship, or concerned that they've talked about it so much that their friends and family may not want to hear it anymore, and so they're reluctant to talk about it anymore. So kind of self-isolation. I think an important thing that sort of came up in both of those examples and that we see too is an escalation of abuse. And so a lot of times these forms of power and control start out and they're really small. Maybe initially offering to pay for a phone bill can seem like a really nice gesture by a partner until it becomes him looking every day to see what calls you're making and, that escalating the power and control there. Similarly with the isolation, at first it can be really flattering if a partner wants to spend all their time with you until you realize that you're not allowed to spend it with anybody else and you're completely isolated. And so, a lot of these behaviors don't start out as overtly abusive or manipulative, but they can build up over time. And then at some point it may become physical violence as well. So I want to say that it doesn't often start out, this extreme violence, and that's often why it can be so difficult for people to leave relationships. I use the power control wheel as a way to show clients that I work with the many different forms that abuse can take. When I meet with someone, it's really common for them to downplay their experience or say it's not that bad, especially if their abuser doesn't use violence or doesn't use violence very often. They'll often say, it's not as bad as other people, like it's just, he does this kind of thing. And when I pull out the power control wheel, they can see that, these are common behaviors. These are all part of abuse and manipulation, and can recognize that what's going on, like they're less alone in the situation. You are currently watching Hotline 21 on CAN TV. I'm Elizabeth, a domestic violence counselor from Connections for Abused Women and Children, and right now we're talking about domestic violence and what that looks like in relationships. Please feel free to call in and join the conversation by calling 312-738-1060. I'm also going to flash the information for my agency again. For CAWC, this is our 24-hour domestic violence hotline, 773-278-4566. You can also visit our website at cawc.org to learn more about our services. Another tool that I use with my clients is called the cycle of violence, which I'm going to put up on the screen right now. So the cycle is divided into 3 distinct phases that you can see here. The first phase is the tension building phase. And this is sort of the build-up. Tension between the people in the relationship starts to increase, and verbal or emotional abuse may start to escalate. This phase can be really frightening and really stressful for people experiencing abuse. They feel that, they're kind of walking on eggshells. Anything they do may set off their partner, and they get really kind of uneasy in the relationship and concerned about every action that they take. Often the abuser's behavior intensifies and at some point reaches a point of release of tension or into that acute explosion. And that's that second phase there, so that explosion of violence. That may be physical. It also may be something like it says here, rape, or using a weapon, or damaging property, or some sort of explosion of violence. After that, we enter the honeymoon phase. At this point, the batterer may start to feel really ashamed and express remorse about what he did in that acute explosion. He will probably promise his partner that he'll never be violent again. He may try to explain the violence by blaming other factors like alcohol or stress at work, or try to blame his partner by saying something that she did set him off. And, if she'd only not done that, he wouldn't have been violent with her. He is going to be incredibly charming. He is going to be really attentive to her. He is going to buy her gifts, help her around the house, kind of do whatever she wants. And for the survivor in the relationship, she is going to feel that, maybe things have changed, and maybe, he is really sorry for what happened. She's probably going to feel confused and hurt by the situation, but also a sense of relief because that tension building finally broke and now they're kind of in a good phase. Both people in the relationship are probably at this point going to be in denial about the severity of the abuse and violence. The survivor is going to feel happy and may want to, have the relationship continue, and also often may not recognize that violence can happen again. The cycle, for me, helps explain why people stay in abusive relationships. I think one thing that is so important to remember is that survivors of domestic violence love their partner. Often the relationship does not immediately start abusive, and so the honeymoon phase can often feel like a return to what the survivor wanted the relationship to be like, hoped it would be like, and sort of that reminder, they see the possibility of what it could be again. They see their partner often when a partner becomes abusive, it's like someone they don't recognize. And so when they're in the honeymoon phase after the explosion of violence, it's almost like seeing the person that they fell in love with, that kind of thing. And survivors want to believe that the violence is a one-time thing. They see their abuser apologizing and being charming and loving again, and they want to believe that this abuse won't happen. One thing that also is important to note when I work with clients, when I show them the cycle of violence, is that, often the cycle gets shorter and shorter, and that's a warning sign that we look for in domestic violence relationships. With really serious situations, there may not even be a honeymoon phase anymore. It may go straight from tension building to the acute explosion. And so that is something that we talk about because that's a sign that the relationship is getting even more dangerous. And I do want to say that not all domestic violence relationships follow this pattern, but a lot do, and it can be a really helpful way for my clients to recognize what's going on, identify patterns in the relationship, identify sort of warning signs if they're worried they're in the tension building phase and getting close to a violent incident, and that can be a way for us to safety plan and make sure that we're keeping them safe from further violence. Also, a lot of clients that I work with in the hospital are between the stages of the violent incident and the honeymoon phase, especially if they're in the hospital due to the injury from a violent incident. Often I'm meeting with them at the time of crisis and giving them information and resources. But between the violent explosion and the honeymoon phase, they may not be ready to admit that this is a domestic violence relationship, especially if that's the first time violence has occurred, or if they're already hearing from their abuser, apologizing, trying to get back in their good graces. The survivors are really hopeful that things will change, and they may not be ready to leave the relationship. So really the best thing that I can do is give them information, try to talk to them about DV and educate them a little bit more on what it looks like, and let them know that I'm available as a resource if they ever need me in the future. I also know for friends and family of a person in an abusive relationship, this can be really difficult to understand. It can be hard to understand why someone may stay in a relationship that you see from the outside as just being, full of this tension building and then violence. But it's really important to not withdraw support or ask them why they don't just leave the relationship. The abuser wants to isolate them, and it's really critical for survivors to know that they have a safe place to talk about what's going on. And I understand it can be frustrating. It can definitely be frustrating for me as an advocate when I hear a client has gone back to their partner. But what a survivor needs is your empathy and understanding and your support, because at some point, if they ever do want to leave the relationship, they're going to need your help. You are currently watching Hotline 21 on CAN-TV. I'm Elizabeth, a domestic violence counselor from Connections for Abused Women and Children, and today we're talking about domestic violence and what that looks like in relationships. Please call in and join the conversation. I'd love to hear questions or comments. The number is 312-738-1060, and it should be on the bottom of your screen as well. And now for my last few minutes here, I want to talk about some common myths around domestic violence. One is that it is easy for people to leave domestic violence relationships, and I just want to say first that is absolutely not true. It is very difficult for people to leave relationships, and often it takes multiple attempts before people are able to leave the relationship for good. I've mentioned some reasons already why it can be difficult. One main reason is lack of resources. Many people who live with their abuser have nowhere else to go, especially, we see a lot of abusers who move their partner to a new city where the survivor has no, resources or a support system here. There are also a very small number of beds in the city of Chicago in domestic violence shelters, which I think is something that people don't always know. There are only about 160 or so beds, and they're often filled. Especially if the survivor has children, it can be really difficult to locate a safe place for them to spend the night. They also may not have their own financial resources in order to get their own housing due to financial abuse and control by their partner. And so sometimes it can feel easier and safer to stay in a relationship that is violent than it is to try to go sleep out on the street somewhere. Another reason leaving is so difficult is that leaving a relationship is often the most dangerous time for survivors in relationships. I always say that my clients are the experts on keeping themselves safe, And often they know that the most dangerous thing they can do is leave the relationship. They say things to me like, if I leave, he's going to kill me. And part of that is that at the time a person leaves a relationship, abusers experience a complete loss of control and may resort to extreme acts. I think a really chilling statistic in Chicago, in 40% of cases in which a woman was killed by her partner, an immediate precipitating factor was her leaving the relationship. And you see this all the time in the news where, a woman leaves the relationship, tries to get away, which is what everyone tells her she needs to do, and the partner finds her and kills her. Another common myth I want to tackle is that abuse is caused by the abuser drinking or using drugs. While there definitely is a connection between substance use and violence, there is no research that says drinking directly causes violence. Substance abuse is often an excuse abusers will use to avoid taking responsibility for their actions. When safety planning with clients, we definitely talk about the impact that alcohol has on their partner. It can make the abuser more dangerous and can often make him more reckless and willing to use violence. But, him getting treatment in Alcoholics Anonymous or something similar like that is not going to stop him from being violent if he doesn't take accountability for his violence. I think another myth that's important to note is that abusers are inherently violent people. In fact, abusers are often incredibly charming and are very careful about when they use their violence and controlling behavior. And this can be really difficult for survivors because, when he's only that way with her, that other people may not believe that he's capable of being violent towards her. And so it's important to remember, if someone discloses violence to you, that just because you've never seen that side of him doesn't mean that it's not true. And the last myth I wanted to address is that victims do things to cause the violence that they experience. Domestic violence is never the victim's fault. It is an intentional choice made by the abuser to use violence and coercion. Victims do not choose to be abused. They do not like being abused. And it is all abuses due to choices made by the abuser. I think that a lot of people can think that, there must be some reason that he's abusing her, and that's just not true. It is a choice that he has made. It is an intentional choice to exert power and control. Domestic violence is incredibly common. 1 in 4 women and 1 in 7 men report experiencing physical violence in their relationships. If you or someone you know is in an abusive relationship, please know you are not alone and help is available. As I've said, domestic violence can be incredibly isolating, and I know that it can feel like there's no one there, but that's what organizations like CAWC are here for, and I'm going to put the information back on the camera. Our hotline number is there, 773-278-4566, and our website is cawc.org. There are people available at all times to talk to you. I want to thank you for watching today. My name is Elizabeth. I'm an advocate at CAWC and the Hospital Crisis Intervention Project at Northwestern Memorial Hospital. And today we've been talking about domestic violence. If you have questions, you can call our hotline number that I just showed. But thank you so much for watching and have a good night.